Get the whole story.
COVID was bad. We were right in the eye of the storm.
Everybody, it was a lot of people, everybody was coughing. But you know, at that point, all we kept hearing was, it's in China.
In the hospital, the beds were full.
People don't want to come close to you. When you need the most help, you're not really getting it as much as you need to.
It was a scary time. My friends got COVID. My siblings got COVID. We saw death all around us. America is the richest country in the world. They have the resources. We had the capacity to produce enough ventilators, but we waited. We took too long, and people who should not have died, died. This was not a healthcare crisis per se. This was a management crisis. And you can see, as soon as management changed, the tide turned.
I know you've all been waiting for this amazing show where we take you on a journey of a lifetime, a journey to taste and experience the life of Kenyans in the diaspora. No matter where you are, if you've got a story worth telling, we shall be there to help you tell it. Hello and welcome to this first episode of Diaspora Life with me, Pastil Telewa, right here in the Kenyan capital, Nairobi. To kick off this great show, we fly all the way to the state of Delaware in the US, where my co-host Chris Wamalwa brings you a story of Kenyan frontline health workers and their amazing story of triumph and resilience. Over to you, Chris.
That is correct, Pastel. Hamjamboni wa Kenya popote mlipo. This is Diaspora Life, stories from Kenyans living abroad. I'm right here in Newark, in the state of Delaware, in the United States of America. The COVID-19 pandemic disrupted lives, pushed the healthcare systems to its fullest capacity and created a global economic slowdown. With over 47 million confirmed COVID-19 cases and more than 7,000 deaths, the US was greatly impacted. To bring this into perspective, here are the untold stories of Kenyan-born nurses who have experienced it firsthand. This is Michael Mugo, born and raised in Kenya, but who now lives in Baltimore, Maryland. Mike works in a healthy facility associated with the famous Johns Hopkins University Hospital, also based in Maryland. For more than a year and a half since the coronavirus crossed the Atlantic Ocean from China and landed in mainland USA, Mike is one of the frontline workers who have been battling this pandemic for more than a year now.
I've been a registered nurse for more than 20 years. I work in mental health, but I'm also an activist as my side hustle, as people say, the hustle. That's my hustle, concentrating on immigration and also healthcare.
How was COVID really? Can you give us a picture of how it was, especially in the US?
COVID was bad. I mean, I can say, I don't even think most people appreciate just how bad it was, especially for us. Most of us immigrants work in healthcare, and so we were right in the eye of the storm. So we dealt with COVID. It was all around us. We saw death all around us. And in the hospital, the beds were full. I mean, this state, as in many states in the US, COVID was rampant. People died, and especially we have an older generation. I supervise a small nursing home that had a lot of COVID, to the point I started thinking, just a matter of time before I get sick. And at times I thought, I didn't sign up for this. I may not be able to make it. I may not be able to go home. So it was a scary time, and it was very dark. I remember thinking, economically, this is going to be devastating for a lot of people. For us, I have a mother who's older. I worried about getting sick at work and then going home and making her sick. And she was not going to survive this, because most people in her age are the population that I was taking care of, and they were not surviving it. But luckily, things have turned around and people are getting vaccinated, and suddenly we can see a steep decline in infection rates. But I can tell you, I can't even describe just how bad it was. It was terrifying. My friends got COVID. My siblings got COVID. I mean, it was everywhere. It spared no one. And for those who got COVID, I had a front row seat to their misery and their suffering. And I worried, you know, if they go to bed, are they going to wake up in the morning? I worried about that. But luckily, I didn't lose anybody directly. We did lose some immigrants to COVID, nurses who worked very hard. We did lose them. And some are still carrying on with the, you know, the side effects of having had the illness. But luckily, a lot of us were spared, but it was a very, very frightening period.
It is true that the pandemic in the US is still far from over. The Delta variant is ravaging the country, especially in the so-called red states in the South and Midwest. But the overall situation in the US is definitely better thanks to President Joe Biden's comprehensive vaccination program. In the US, anybody who wants to be vaccinated can be vaccinated anytime. This is the reason why Mike can afford some time off on a Friday afternoon and treat his girlfriend, Robin, to a sumptuous meal in this high-end hotel.
COVID wasn't a health crisis per se, it was a management crisis. America is the richest country in the world. They have the resources. They have more resources than they need. We were not prepared for what came at us. We should have been. The writing was on the wall. We were not prepared. And I remember, you know, being told, you know, you can't use, you have to be careful how you use your PPI, you know, your gloves, your gowns, your masks. You have to wear them, and if they're not dirty, you can turn them inside out, you can clean them, you can. And I thought to myself, I can't believe this. When I went to school, you're supposed to use a N95 and then discard it. For more than 15 years, that's what I've done. I use it, I walk out of the room, I throw it out. I was hanging on to one for weeks. And I kept thinking, I cannot believe this. Yet the resources were there. The factories that could make this equipment were here. We had the capacity to produce enough ventilators. We had the capacity to surge care to areas that were affected, to New York. But we waited, we took too long, and people who should not have died, died. This was not a healthcare crisis per se. This was a management crisis. And you can see, as soon as management changed, the tide turned. Things are getting better now. I mean, it's been a dramatic turn of events. But there should be no reason why the United States of America, with some of the biggest and strongest systems in the world, the Center for Disease Control, you know, they have some of the best systems. They set the gold standard on what you should do when you have a pandemic. And yet, we were caught flat-footed. We were knocked out. We were the laughing stock of the world for quite a while there. I mean, people wondered what's going on. I mean, people were scared to even interact with people from the United States because they're like, you know, all they saw was death and devastation. We had reached a point where they had mobile morgues. I never thought I'd ever see something like that. I mean, outside of a natural disaster.
Especially in America.
This was a man-made disaster. We saw it coming. We ignored it. We hoped it would go away. You remember those words? It would just go away. Well, it never went away. 500,000 people, more than 500,000 people died who should not have died. And we knew that these people are vulnerable. You have these clusters of people living in nursing homes scattered all over the country. They're close. They live in shared rooms, clustered together. Those were incubators for disease and an infection that traveled in the air.
Wow, that's a really touching story, Chris. Kenyans are quite resilient. So don't go away. After a short commercial break, Chris brings you part 2 of this amazing story. This time, we tell the story of Grace Kamau, a Kenyan nurse who works at the busy Christiana Hospital in Newark. We shall be right back after the break. Don't go far.
This is Diaspora Life on KTN News, and I'm your host, Chris Omalwa. Christiana Hospital is one of the largest healthcare facilities in the state of Delaware. Grace Kamau, a Kenyan-born nurse, works here, and she shares her experience battling COVID-19 at the peak of the pandemic right here in this hospital. In Bear, Delaware, a small suburb in the larger Wilmington city area, less than 10 miles south of President Joe Biden's home, Grace Kamau makes her way back home from her nursing duties at one of Delaware's leading hospitals, the Christiana Hospital. Grace, her husband Ibrahim Kamau, and their 3 beautiful daughters live in this home in this quiet neighborhood. It is the end of a long day and Grace is back home. But before she could hug her family, she has to go through the coronavirus precautions that have now become part of her daily routine. Get out of her hospital scrubs, wash her hands, and take a shower before she could join the rest of the family at the family dinner table.
Hi everybody. My name is Grace Kamau. I've been in this country more years than I've been in Kenya. So I was blessed to be in this country with my parents. They brought me here at such a young age of 15. I went to high school in this country. It's been a blessing to go to high school, to my college years, and also did my nursing school here. I've gotten my master's here, so I have a master's in nursing as well, and also another master's in healthcare administration. So this country has been a blessing. That being said, I've been a nurse for 16 years.
Even though Grace is a nurse, her initial encounter with the corona pandemic was as a patient because when the pandemic started, she was in hospital expecting to deliver her 3rd baby. Before we talk about anything else, give us your blow-by-blow of your experience with COVID-19.
Wow, gosh, I have to say it's been a challenge, but more so I have seen it in the sense of being a healthcare worker, but also I've experienced it as a patient, not necessarily having COVID-19, but having been in the hospital when the whole thing kind of blew up. In 2020, we had one of the our biggest blessing, we would say, in our family. We were blessed with another baby girl in May. But before May, when all this thing was easy, nothing happening in the whole world, we just kept hearing the things that are happening in China. In February 15th, I just happened to be going to work. It was President's Day here in America, but what happened is I fell pregnant and I had to be rushed to the hospital because I fell at home and I broke my leg. So when we went to the ER, everybody, it was a lot of people, everybody was coughing. But at that point, all we kept hearing was, it's in China. It's in China. Nothing's wrong here. You don't have to wear a mask. It's okay. Continue with your life as it is. So it was a shocker for me, being the fact that I don't really work in the ER, but I work with mothers and babies, to see such a lot of people, but people coughing. It just gave me another perspective of, wait, something's kind of wrong here. But I'm still trusting what they tell us, right? So just stay as you are, keep doing what you're doing. But being the fact that I was home and I'd broken my leg and I'm pregnant, so I had to stay home. But 2 weeks after that, the world shut down in America, if you would. Now we had COVID. Now we had unimaginable pandemic in the world, whereby we just kept seeing this darkness, just a cloud of darkness. My kids are home from school. We're not allowed to go anywhere. My husband cannot join me into our appointments with our baby. It was just a very unknown world. It became a place whereby nobody can cough in front of you. It was like, oh my gosh, I have corona. Nobody can go anywhere. You can't even go to the store. Water was running out. Diapers were running out. I mean, it was just like people were in shock, and it was just a crazy time. But to say the least, we had to go through having a baby. You can't do anything. You have to go and become a patient. So at that point, whenever I ended up going to the hospital, being the fact that you don't know what's happening, you become a scared person. Although I've been in healthcare for such a long time, I've become a patient now. Now I come to see the other side of the world. You don't see the nurses are all masked up. People don't want to come close to you. When you need the most help, you're not really getting it as much as you need to. People want to come in and out of your room. Not necessarily do you have corona, but also the policies have changed in the hospital. It's more so the nurses become in and out. They don't become that trusted person that you want to sit down and hug or hold hands when you need it. You become very distant. Everybody wants to stay distant away from each other.
Like many Americans, Grace has been surprised at the rate at which the pandemic has returned. The country had done so well in the vaccination rollout early this year that many people thought the country could have achieved herd immunity by now. In fact, Grace was among the teams that went out in the community to carry out mass vaccinations. As we speak right now, like I said, you work in one of the biggest health institutions in Delaware. Could you speak to the general state of COVID-19 in the state of Delaware?
So one of the biggest things working for such a big institution, you kind of get to see or get most of the patients that are coming through when they have, whether we have trauma, whether they have COVID. So we kind of received a lot of the COVID patients. So like I said before, I do work with mothers and babies, and during Corona time, we had a lot of that coming through. And at that point, what happened with my coworkers would all take turns taking care of these patients so that we just don't expose each other, or rather we take as least amount of time being in a patient's room. But one of the things also that happened is because of this pandemic, I was fortunate enough to also get an opportunity to work with another company called Curative. And Curative, for those of you who know about this company, it kind of got very famous because it came out with one of the first testing for COVID in California. So they were able to get a contract here with the state of Delaware in doing vaccines. So I got an opportunity to work with them as one of their managers here in Delaware, and we had 3 sites, one in Wilmington, one in Dover, and one in Georgetown. And I'm telling you, Chris, we had lines and lines of people. We had sometimes even a day we could give out 600, 700 vaccines because people wanted this vaccine. But as it started in January, but in July we dwindled in numbers because what happened is people who wanted the vaccine got the vaccine. So now we were able to give about 60,000 vaccines from the time we started in January up to July. And then, so now what happened is the numbers went down. But as we see now with the change with the Delta variant and people who haven't been vaccinated, we're seeing it creeping back up. So as we speak, when I went back to work, I want to say in June, July, our numbers were really low. We barely even had any COVID patients. But then now we're talking about it's creeping up. People are not vaccinating, people are not masking, people are not washing. People are starting to relax, but this is not the time to relax because September is coming around and that's the time for the flu season. And if anybody knows anything about COVID, it works or acts like what flu does because it is a respiratory disease, right? So this is a time where we need to be more vigilant. But now everything, if you look in the world, a lot of the numbers are going up because a lot of people are relaxing, a lot of people are not doing what we're supposed to do. So of course the numbers are going up, especially in Delaware.
By June this year, COVID-19 cases in the US were down in 49 of the 50 states. The number of Americans hospitalized by the virus was a quarter of the level seen at the beginning of the year. Vaccinations were climbing steadily, and President Joe Biden announced in May that vaccinated Americans didn't need to wear masks. But the battle is dragging on longer than Biden and indeed everybody expected, driven by a large segment of the country's reluctance to get the vaccine shots and the virus's Delta variant spreading through the unvaccinated community. Cases are now rising in every state. For those ones who don't want to get the vaccines, do you have a sense of what their excuses are?
So I think a lot of things come with education. So with everything, if you're not well educated about something, you're always going to have, you're going to be reluctant to do it. So a lot of anti-vaxxers, a lot of people who are reluctant to do it is more so they just need to be, they have questions that maybe they're not sure of, and maybe they just need to have a little more education about the vaccine or maybe how it works, and then just to see an idea of how bad it can be. You know, the thing is, we know how vaccines work because it's been there forever. COVID vaccine just happened to be, we've used the same technology that has been there before. It's not like, oh my gosh, this is something new. It is just that the how to develop this vaccine was already there. So all we did was just work on getting the vaccine and then use the technology that was used before. And then here we go, we have a vaccine. That's why it was so fast. But what happened is people who are not educated, you know what I'm saying? All you need to do is just educate them a little bit on what the vaccine is, and then maybe somebody can see, okay, maybe it's not as scary as it looks or sounds. So what I've seen, like I told you, working with Curative to give the vaccines, what I saw with a lot of people coming in, a lot of people were reluctant. They knew they needed to get it, but once they come in, they were very, very scared. So what we did, we pull them on the side and just ask them, what is it? What are you reluctant about? What is it that you want us to tell you as nurses? And the moment we explain to them what their fears are, you see some of them like, okay, I'm okay, I can do this. So I think it's just the education part of it, that maybe we just need to do a little bit more of it.
In fact, hospitalization from the virus, having fallen half in June, are back to the levels seen in May. That's why the Center for Disease Control and Prevention had to recently walk back its earlier guidance and tell those who are vaccinated and living in states with high rates of infection to put back their masks, even in indoors.
One of the things that has happened during this COVID-19 is that we are seeing an increase in social issues, especially domestic violence and depression, especially among the young people. Having raised in this country, can you speak to that, please?
There was a huge increase of domestic violence, whether in the Kenyan community or even here in the American community. We saw a lot of that, especially if you look in Kwitu. Kwitu is the Kenyan women in the USA. It's a nice organization of women that come together. We saw a lot of increase of domestic violence where people were kind of reporting that too. But I think what happened with, we were given the opportunity to face such issues that we keep on the hush-hush, if you know what I mean. Yeah. And to understand that mental health is real. Because depression comes with mental health, right? And being stuck at home, seeing the same, whether it's the same abuser, whether it's the same issues, whether it's poverty, whether it's lack of jobs, it causes people to lash out in different ways. But also what happens is, because you're forced to stay in one place, you're forced to evaluate yourself and see, what is it that I need? You know, we talk about, I was sitting and talking to my husband, and the biggest thing that we said about this past year is that if you did not change when Corona happened, then you're not gonna change. What I'm talking about, to become either a better person or to become a worse person, to reinvent yourself to be like, wait a minute, maybe I don't have to be a nurse anymore, because nursing was put in the forefront. You have to help people. So if you do not go into that field having a passion, then you're forced to see that this is not where I need to be, because now you are forced to do that job that you really signed up for. It's not about money, it's about passion, it's about compassion to other people, because this was a year whereby you really needed to put your your best foot forward and serve other people. Not necessarily just nursing, but also other jobs. It could have been like, maybe I'm not meant for this job. Maybe I can start sewing, because a lot of people, stayed at home and were like, okay, I'm good at sewing. Maybe I can be a singer. Because Corona made us reinvent ourselves, say, what is it that you want to do in life? Because we took a lot of things for granted.
As a family, dealing with a young kid who's just come into the world, juggling between a young kid, your family, and your work.
Oh my gosh. I remember my first day back now after having the baby, going back to work, and I remember thinking, I have to remember what I'm supposed to do. So it became a mental note for me, like, okay, I have to wash my hands, I have to do this, I have to make sure I take off my shoes before I come home, I have to make sure I don't touch the baby, I don't touch anything that the baby has before I shower, so that I don't bring it home, because I'm the one leaving the house, right? And I'm coming home, my kids are home, my husband's working from home, so I would hate to be the one that exposes them, and especially the baby who just doesn't have as much immunity as anything else. So that was also my biggest reason to get the vaccine. I got the vaccine when we didn't have enough studies of breastfeeding moms. So I was very apprehensive at first because here I'm breastfeeding a new baby, a newborn. Am I exposing my baby to something that could be detrimental to her? But I educated myself. I reached out to some of my pediatrician friends and I just asked them about what studies have you seen out there about breastfeeding and it affecting the baby, because now I'm taking something into my body to protect me, but also I'm giving my baby as well because I'm breastfeeding. So I had to make that choice, and also I had to educate myself.
In many ways, what is currently happening in the US is a mirror reflection of the country. America is indeed a country of contradictions. To the rest of the world, especially those countries that are struggling to get the first vaccine shots into the arms of the people, the fact that almost half the population of America has refused to get vaccinated doesn't make sense.
That is all the time could allow us to bring you today. There are millions of great and untold stories of Kenyans in the diaspora, and we shall be sharing them with you every week on Saturdays at 17:30 GMT on KTN News and on Standard Flix application.
That's absolutely correct, Chris. Thank you so much for compiling this. And to our viewers, asanteni sana for tuning in. Don't miss any episode of this show. And if you're outside Kenya, we got you covered. Download Standard Flix app and stream these and many other shows and stories packaged specifically for you. And before I go, here is a bonus chat with the chair of the Kenya Diaspora Alliance, Shem Ochuodo, on issues affecting Kenyans in the diaspora, and a sneak peek of the upcoming Diaspora Conference.
We'd want to see diaspora, some of them returning or retiring home to a livelihood. They come back, they have a return on investment, and they start their businesses, which they would have been investing in. So that's our goal. We want to see the remittances better utilized.
Daktari, do you think the Kenya Diaspora Alliance has adequately represented all the Kenyans living in diaspora, from the smallest of countries to the biggest of them all?
We are always quick to indicate that we do not purport to represent all Kenya diasporas. Indeed, Kenya Diaspora Alliance is a federation of now 46 registered diaspora organizations, one from France and another from the US, just joined the past 2 weeks. The combined nominal membership of the 46 organizations is about 250,000, about 250,000.
Yeah.
Obviously, that's just about 10% of the 3 million or 4 million Kenyans abroad.
Yeah.
So we cannot purport, we don't purport to represent all. However, we try as much as we can. We are a non-profit organization and governmental, but work very closely with government, the concerned arms of government. Diaspora are very passionate about being able to elect their leaders, taking part in the electoral process.
Yeah.
Again, in this regard, we have lobbied to the extent possible the leadership. There are countries like Lesotho or Swaziland, now Eswatini,
yeah,
which are surrounded by South Africa. But to go into South Africa, you need a visa, usually I think $70 or something like that. If we can add those 5 countries,
yeah,
because we know those are where a majority of Kenyans are. It's estimated that of the 3 million Kenyans,
yeah,
that 600,000 are in North America, are in the US, 300,000 in the UK, 200,000 in Canada, 100,000 in the UAE, 80,000 South Africa. At that time, when World Bank came up with these figures, which was about 4 years ago, 80,000 were also in South Sudan. So we want to encourage diaspora that apart from the remittances that come, let them be also involved in economic and cultural renaissance of Kenya and Africa by extension.
Great.
We do know that African Americans have a spending capacity of $1.2 trillion. That's bigger than the GDP of any African country.
yeah.
Many of them have said, look, we want to bring some of this money into Africa through Kenya, through Konza City. So Konza is very key, and it's one of the confirmed partners during the convention. And we're looking forward to working together with it as a techno city as a mechanism to bring in capital and also knowledge.
KTN News, Get the